First off, I want to thank the Ovarian Cancer Research Alliance for this opportunity to present on chemo brain. This is a really important topic. A lot of people don't talk about it, and it's one that's near and dear to my heart because I am a cancer survivor and I experienced chemo brain. So let's get started. So, dealing with cancer takes a lot out of us. This is not a surprise to anybody. There are the expected challenges and changes that come scars and hair loss and weight gain or weight loss and nausea and fatigue and all sorts of things. But what we don't expect are the changes in attention and memory. And at first, it's the little things. You can't find the words you're looking for. You realize you forgot something that you really should have known. You missed a deadline at work because it fell off your radar. And you can't remember if you need to turn left or right to get to the store. And you realize that you can only follow one step at a time in a recipe. And even then, you go back 6 times to check to see if it's 1 tablespoon or 2 teaspoons. And as a consequence, you start to pay closer attention to this. And as you do, you get more stressed and worried that it's going to happen again. And the more stressed and worried you get, the more you have these issues. And then others start to notice it and point it out to you. And the more you get stressed and worried. And you have what I refer to as memory misadventures. You may tell a scammer your social security number, or you missed a deadline because it totally fell off your radar, or you forgot to turn off a burner when you're cooking, or you blurt out something and it's really embarrassing. And all of these things result in stress and anxiety and embarrassment. And you enter what I like to refer to as the cancer-related cognitive impairment cycle, where you start to notice your memory issues, you start to pay more attention to it, you get more stressed. The more stressed you get, the more memory and attention issues you have, and the stress and anxiety climbs, and you have more memory and attention issues, and then others comment on it, and it goes in this cycle. And when you complain about it, you tell the healthcare team that you have chemo brain, and they reply to you that, so sorry, it's an unfortunate side effect. And you might just have to live with it. And we hope that it's going to resolve soon. And what happens is these come as surprise. At first, it takes a while for you to realize that your brain isn't working the way it used to. The medical team doesn't usually talk about it until you bring it up, and it's upsetting and scary. People start to worry that they have dementia or Alzheimer's, and this leads to increased anxiety, stress, sadness, and isolation, and patients don't know what's wrong or how to fix it. And collectively, these are symptoms. You see symptoms of confusion, memory problems, problems with focus and concentration, an inability to multitask, and word finding problems. And so, what this is collectively known as is chemo brain. And this is technically cognitive or thinking problems that appear after a person begins cancer treatment. And these include issues with memory, concentration, and multitasking. And it goes by many names, but formally it goes by CRCI, or cancer-related cognitive impairment. But most people agree that what this is it's a decrease in mental sharpness, it's an inability to remember certain things, trouble finishing tasks or learning new things, troubles with focus, having a short attention span or feeling like they space out, sometimes trouble remembering details like names and dates, or even sometimes larger events, trouble multitasking, like answering the phone while cooking, or losing track of one task. And people find themselves being more disorganized, slower to think, really having issues with word finding, and recognizing that their brain just doesn't work the way it used to. And this leads to a lot of concerns and worries and embarrassment. There can be challenges in social life. People may actually stop going places because they're afraid they're going to say something or they can't remember names. There can be challenges in family life. Family members or say something to you like, you've already asked me that 5 times and I've answered it. There can be challenges at work. There can be other issues, and there's an overall decrease in quality of life. And this anxiety leads to other issues, like issues in learning. It can impact an individual's working memory and problem solving, and it can make it difficult to learn and retain information. There can be issues with memory where holding on to information is an issue, or sometimes things are forgotten altogether. For me, it always felt like it just went over the edge of a cliff and it didn't come back around until something happened. It can be an issue with communication because it can stop somebody from asking for the help that they need. There can be problems with decision making because there is a disengagement in the prefrontal cortex that affects the planning and understanding rules and consequences and regulating emotions and decision making. If you think about people who are under the age of 25, that prefrontal cortex hasn't developed very well or is not fully developed. Chemo brain, cancer related cognitive impairment, impacts the prefrontal cortex. So you can have the same issue that younger people might have. It can affect brain health, where there can be negative effects on both social, not just both, but on social, physical, emotional, and overall performance. And then, of course, it can affect the stress level. It can make somebody very uncomfortable in an environment that they used to be very comfortable in, be it at home or work or school or whatever. And so there's the emotional impact of CRCI that happens too. This is cancer brain fog can make it difficult to do everyday tasks. It may make somebody feel angrier or more tearful than before. It can lead to emotions like anxiety, stress, grief, and frustration. And people become very sensitive to the frustration of those around them, which can make you struggle more. Patients and survivors can feel crazy. They are sensitive to how other people perceive them, and it can make it more difficult to do everyday tasks. It can make people feel like they're kind of losing control, and the patient and the loved one are really struggling with what is going on. And for people, cognitive impairment is rated as one of the most problematic symptoms. So think about that. There are so many symptoms that come and side effects that come with cancer treatment, but cognitive impairment ranks right up there as one of the most problematic ones. And survivors report that it contributes to a diminished or reduced quality of life. There can be economic, emotional, and interpersonal costs. There can be difficulties returning to work, a lot of concerns and fear about that. And it can interfere with treatment plans, which then lead to increased side effects and reduced survival rates. So you may ask, why is that the case? That's because if you cannot remember to make your appointment to go see your oncologist or to get a scan or to get your lab work, it's going to interfere with your ability to get the proper treatment. So this can get in the way. Who gets it? This is a really good question. 75% or more of cancer patients are going to experience some kind of cognitive impairment during or after their treatment for cancer. And for about 35% of them, that impairment persists for months or years following treatment. Patients will frequently report this to their doctors, but the doctors struggle with the diagnosis and the management of it. And how long it lasts can be a major factor in how it affects somebody's life because there's a lot of variation amongst patients. These brain effects can happen quickly and only last a short time. Some people have long-term mental challenges. The changes can be subtle and some might not even notice them at all. But the people who are having problems with these issues are really aware that there's a change in how their thinking is happening now. And most people don't tell their cancer team until it's affecting their everyday life. Well, chemo's not the only culprit. It is known mostly by chemo brain, but it's not just chemo. It's probably some combination of surgery, general anesthesia, chemotherapy, and or radiation. So let's look at that for a second here. In surgery, it is very well known that there are post-operative complications. People often, especially in cardiac and non-cardiac surgeries, have memory issues following surgery. And that effect is transient. It doesn't last that long, but it does happen. So if somebody is a cancer patient and they've had surgery, especially a very complicated surgery, they are probably going to have some memory issues related to that. In chemotherapy, we do know that the chemo drugs can and immunotherapy drugs can cross the blood-brain barrier and they affect the gray and the white matter. And the exact mechanism of that is not understood fully, but we do know that there can be some direct toxicity to brain cells. There can be inflammation and alterations to the neurotransmitter function. Radiation, of course, we all know, or people know who have had radiation, that fatigue is part as a side effect. Well, fatigue, of course, is an issue that impacts cognitive functioning. And radiation also does, of course, because if you think about it, the area that's being radiated, there's a blood flow that goes through that, and that blood is getting radiated and it's going up to your brain. So those things all impact cognitive function. There's also the effects of steroids and anti-nausea medication, drugs that are used in surgery, or pain medications. Anybody who's had pain or serious pain knows that affects the ability to sleep, and that can affect people's ability to remember and function very well with stuff. Sorry, that's sort of struggling saying that myself, but that happens. There's also the side effects of treatment, especially for patients who have low blood counts, if there's infection, sleep impacts, of course, as I've already mentioned, insomnia, fatigue, nutritional deficiencies, and hormonal changes. So certainly a gynecological cancer is you're going to see some hormonal changes, right? So these also affect us. Then there's the biology of the cancer itself. There's an inflammatory response that triggers neurotoxic cytokines. And of course, sometimes the chemo brain is related to the malignancy itself. So people who have had whole brain radiation also have CRCI, and then anybody with poor DNA repair. Now, there are non-cancer contributors to this as well. Somebody who has lack of exercise, loss of muscle mass, menopause, patient age, all of these things also impact cognition. There are the side effects of medications for other health problems. Many people come into cancer with pre-existing issues like high blood pressure or diabetes. Then, of course, some of the changes may be as the result of unknown biological causes. And then the role of stress and mood and loneliness, depression, and or anxiety also come into play here. And most patients are going to have at some level some sort of depression and anxiety that goes hand in hand with cancer diagnosis and a cancer treatment. Now, chemo brain is hard to study. Some changes are mild. When patients do undergo neuropsych testing, those tests are not sensitive enough to pick up changes in CRCI. So patients often pass these tests even though they're reporting forgetfulness and other cognitive changes. We know that most people aren't going to opt to get a neuropsych testing for baseline before they start their cancer treatment. That's the last thing most of us are thinking about. So we don't have a baseline pre-cancer treatment baseline to see the changes post-treatment. And again, as I mentioned already, people with CRCI perform within normal ranges on existing tests. The first reports of chemo brain appeared in the 1990s, and these were typically, not surprisingly, complaints by breast cancer patients. Of course, women are more apt to speak up about issues that they're having. And so most of the early tests were done on women. Most of the early studies were done on women. This is not exclusive to women, although most of the studies involve women, which of course is totally inverse of how it usually goes, right? And the comments and the complaints were often vague in the beginning. It's hard to think, I'm slower at work, and I just can't do the things I used to do. But with the advent of functional MRIs, this was the first demonstration of the changes that happen because of chemotherapy. And so when I saw this picture the first time, I almost burst into tears because here was proof that something had changed in my brain. So what are you looking at here? On the left side, very helpfully with these little arrows, you see the before and the after chemo. And what you're seeing here and what you're looking at are these lime green colors. What those colors represent are big decrease, a huge decrease in the glucose usage by the brain. So our brain uses glucose as energy. And so what you can see is that the brain is using less energy post chemo. So this was the first clear demonstration that cancer and cancer-directed therapies can affect cognition. And you can see also with these advanced images, you can see the structural and functional brain changes before and after. Now, I also like this one. This next one is from a study in Stanford, and this shows differences. The left image is the brain activity of a woman with no history of cancer. And what you can see on the left side with those bright yellow orange colors is she has more activity in the prefrontal cortex when she was given tasks that involve storing memories. The right image is of an image of a breast cancer survivor who had chemotherapy. And you can see that she has to use more diffuse regions in her brain when she's asked to recall memories. So it's a big change here. You can see the difference here. Now, there was a study back in 2015, 10 years ago, out of the University of British Columbia, where they studied people with chemo brain or complaints of chemo brain and those without. And what they discovered was that somebody who hasn't had cancer, who has quote unquote a healthy brain, that brain functions cyclically. It spends some time wandering and some time engaged. Somebody who's had chemotherapy, that brain is stuck in a chronically wandering mode and it's disengaged. And what's interesting here is that even when survivors thought they were focusing, the measurements indicated that a large part of the brain was turned off and their mind was wandering. And then it was also suggested that when they were asked to simply relax, their brain was more active. It was kind of wandering around doing things instead of relaxing. So it was an interesting study, and I personally thought that I loved this visual image of my brain kind of wandering around. Now, there's lots and lots of studies. When I first started talking about this with patients, I used to have a presentation that was 50% filled with, like, here's another study, and here's another study, and here's another study. It was almost as if I wanted to prove to myself that this was real. Now I'm down to just a few slides. So, what are the general findings of CRCI studies? These they found that the parts of the brain that deal with memory, planning, putting thoughts into action, and monitoring thought processes and behavior and inhibition are smaller and or less active after cancer treatment. Additionally, they have found that patients are slower to learn new things. It takes them longer to recall what they know on memory tests. Their response and reaction times are slower. Their attention and their concentration suffers. They have more trouble using recalled information and language, and that these changes are still seen in scans 5 to 10 years after treatment ended. So, what's available for people who are experiencing CRCI? Here's the bad news. The options to treat these symptoms are limited. There is no standard of care that exists. There's no universal recommendation. There are no medications that are suggested for this. People say, what about, couldn't I take something for like ADHD or some of these memory things that patients with dementia have? Those medications have been shown not to help. They don't help, and not only that, they have side effects such as increasing anxiety or increasing sleep disturbance, both things that lead to more cognitive issues. So the recommendations are pretty standard. Most effective, they found, are meditation, cognitive training and rehab, and exercise. So why would that be? Because that's managing the stress cycle that I mentioned before. They also say address the common issues. So you're addressing things that you can control and have something to deal with, right? So if you're having sleep disturbances or sleep issues, get the sleep dealt with. If you have a history of depression or current diagnosis of depression and or anxiety, get those addressed because those things will help bring the rest of this back into control. You can ask for a potential evaluation by a neuropsychologist or a speech pathologist. I usually just go straight to the speech pathologist for assessments because a neuropsychologist will do all the testing and then they'll say, you're going to need to see a speech pathologist for treatment. The speech pathologist can also do the testing, so why not cut out the middleman? We also know that psychotherapy, cognitive behavioral therapy, and counseling help manage the CRCI related anxiety and stress. And so those are techniques that can be helpful as well. Okay, Linda, but what about my memory and attention problems? Well, I want to point out that not all memory failures are cancer related. When we start having these memory misadventures, we start to blame all of it on cancer treatment and the cancer side effects. But let's take a look at this. Do you ever forget a phone number? Or do you lose items around your house? Or forget names? Or forget where you're parked? Forget the groceries that you went to the store for. Forget locations in the mall, or forget why you entered a room, or lose your wallet, or forget content of conversations, forget your keys, forget appointment dates, forget directions. These are all normal things to forget. Everybody does this, not just cancer survivors, everybody. My husband does all of these things and he never had cancer. I use him as my normal. So the thing is, we all have normal forgetting. Even people who haven't had cancer or cancer treatment forget things. And the reason why is that our brains only have so much space. It helps our brains and helps us sort out what's important and what isn't. So it's more important to remember a sequence at work than it is to remember what you ate for lunch. And memory and attention are all affected when we're stressed, fatigued, or hungry. So what can I do about my chemo brain? I have 7 keys for you to managing cancer brain fog. And actually, I should start calling it cancer brain fog. That's actually a better term for it, right? I mean, chemo brain, if you didn't have chemo and you're having CRCI, you have to have something, call it something else. So cancer brain fog is the term I'm trying to use these days. So the first step to this is figuring out your problem areas. This is a really, really important piece because when you know what your at-risk situations are, it helps you prepare. So how do you do this? You keep a diary or log and note when something happens and causes problems. And note at that point what's going on. What medications did you take? What was the time of day? What was the situation? You don't need to complete every little lapse, but you want to get a sample of at-risk situations because as I said, this awareness helps you self-monitor and helps you develop an understanding of situations that can cause you problems. So for me, I know that when I start to have word finding problems or when I start to try to read something and it just looks like a black blob, I know that those are at-risk situations for me. Those are situations that make me take a step back and go, hey, what's been going on? And usually I need to look at this because this happens to me when I'm fatigued or stressed or haven't been getting good sleep. And when that happens, then I take a step back and go, okay, what are you going to do? Well, you need to go to bed at a good time. You shouldn't be staying up till midnight or getting up at 5 a.m. Instead, you need to look at your sleep. What else is going on? What can I do to manage better so that I'm functioning better? But if I don't know what my symptoms are, I can't do anything about it. So when you're keeping this log, you're going to note when your problems are most noticeable. Are they worse in the morning or the evening? Do you have more trouble when you're hungry or tired? Do you have more problems when you're stressed? Does it help you to take a nap or walk or have a snack? What are the things that make the problem better or worse? So this gives you an action plan. It helps you identify what's going on and what you might be able to do. Step 2 is managing your stress because we want to short circuit that stress cycle. Remember, I talked about that earlier. When we have anxiety and stress, that triggers a fight or flight or freeze response, and that gets in the way of your attention and memory. And we know that ongoing stress worsens your CRCI, and we know that ongoing stress changes your brain activity and it impacts your memory. So it's important to use self-regulation skills because those are going to help you improve your memory and attention. And there's lots of ways to do this, but the most important is to use your body and brain to help you because the relaxation response is the anti-fight or flight or freeze response. And there are many ways to do this. You have probably learned these things during your own cancer experience, but breath work is important. Progressive muscle relaxation is something you can do, quick relaxation, guided imagery, yoga. Those are all good things you can try. And one of the reasons why we suggest that you look at your breath work is because when you take a deep belly breath, when you're doing diaphragmatic breathing or yoga breathing, your diaphragm presses on the vagus nerve, which is the longest nerve in your body, and that creates a relaxation response. And this is involuntary. You cannot be anxious and relaxed at the same time. Progressive muscle relaxation is working through big muscle groups by tensing and releasing those muscle groups. When you tense something and you let it release and you let it relax, it gets more relaxed. And so doing a progressive muscle relaxation technique can help. There are lots and lots of apps out there. There are lots of things on YouTube that will walk you through this. This can be 10 minutes, it can be 20 minutes, it can be an hour, but you can find those. Quick relaxation is something that happens within 5 seconds to 5 minutes. And it's also a very, very similar thing. But the thing is that you learn to use the strategy throughout the day. You don't need a recording for that. And it helps you pay attention to the fact that you're stressed or your muscles are tight. And then you take a nice deep breath and you relax them. And so that is something that when you're recognizing that you've had a memory misadventure, that you just stop and you give yourself that quick relaxation and that brings that arousal level down and it helps you be able to focus better. Now, a couple of quick tips about doing PMR, progressive muscle relaxation, and quick relaxation is that all of these things, both of these things work because you're slowly tensing and releasing muscle groups, but you only have to flex those muscles to 30%. You don't have to squeeze so hard that you're hurting yourself. The thing is you tense to 30% and then you drop it very quickly because you're overlearning this letting go of muscle tension. Now, keep in mind that if a muscle or body part does not feel comfortable, just focus on it and relax. The intent here is to relax the muscles, not to induce pain. So be practical. And then keep in mind that distracting thoughts happen. So don't try to push them out of your mind. Just observe them and then go on to the next step. And also, another thing to keep in mind too is that becoming a good relaxer is like going to the gym. It is built through accumulation and practice. So I learned many years ago to do breath work and to do progressive muscle relaxation. And it takes me maybe 3, 4 rounds of breath breathing. My body goes, oh, I know what we're supposed to be doing. We're supposed to be relaxing. And the same thing with the tensing and releasing. My body goes, oh, I know what I do because I have learned it. It's muscle memory. So the more you practice it, the better you get at it. It's also important as part of this to increase your mental and physical activity. There's no one magic activity. So just like if you always walk on the treadmill, at 3 miles per hour, after a while, you're not really doing your body any good because your body gets used to it, right? So diversity and novelty are important, both for our brains and our body. But we do know that physical activity improves fatigue and mood. That is a stress management thing. And these are ways to address depression and anxiety through a non-medical way. There's also other things that you can do for stress management. You can socialize, take classes, play games, preferably with other people, go for walks and really look around, take a mindful walk, get plenty of rest and sleep. And of course, if you are feeling depressed or anxious, talk to your doctor about the possibility of taking some medication. Now, another thing here, I think this is number 3. I should have probably put numbers on these. We want you to build skills and use techniques. So the first tip here is that we want to build on your remaining strengths. So maybe you lost certain abilities. So we don't want you focusing on those. We don't want you to focus on trying to restore those. We want you to learn to use compensatory strategies that can decrease the negative consequences of your memory and attention issues. In other words, we want you to use what is still there. Because keep in mind, no one comes through cancer treatment looking like they spent a month at the spa. And so we want to use areas of strength to compensate for the areas of weakness. So you may not be able to do things the way you used to do that, but you can do it in a different way. Okay. This is like building a new habit. So one of these techniques is giving yourself a moment. I like to think about when I can't think of a word, I like to think about words and memories like having things on a conveyor belt. So you've been to the airport lately and you've gone to the luggage claim. You know how you see your suitcase go past, you didn't get it in time, and then you have to wait for a minute or two for it to come back around on the conveyor belt. It's the same thing about words and memories. So you have to be patient, you have to be relaxed. It will come back around. The other way to think about it is like a kinked hose. So when you have a hose that's kinked, you can turn the water up as high as you want, right? And it just dribbles out. Well, if you can relax, that information is going to flow a little bit more. So again, this would go back to using the breath work or the progressive muscle relaxation or the quick relaxation. Those are all things that are going to help you relax in the moment and will allow that information to go. The stop technique is another one, and this is a great one. I suggest this a lot to different people. It's very simple. You stop what you're doing, you take a nice breath, you observe what's going on in your body, your emotions in your mind, and then you proceed to what's the most important thing right there. This is a great technique for when you get interrupted. So somebody comes to you and you're trying to focus and they interrupt you. You say, just give me a second. You stop, you take that breath, you think about what you're trying to remember to do so you can come back to it, and then you proceed to the thing that they're interrupting you for. So this stop technique is a really great one for helping you refocus and also to help you when you are distracted. One of the things I like to describe and help people understand is I like to think about our brains as file drawers. So prior to cancer, our memories and our words and everything else were nicely filed in the file drawer. But you've had cancer and you've had cancer treatment. So CRCI messes up the file drawer. It's like somebody came around and dumped out those files, mushed it all up, and then just jammed it back in there. So the information is still there. You are relearning where that information is filed. When I had my neuropsych testing, my neuropsychologist said to me, Linda, all of that information is still there. You have to relearn to trust your brain. And that was probably some of the best advice I got because it gave me permission to take a moment to kind of let that information come back around on that conveyor belt. So another thing you can do while we're talking about file cabinets is one of the things to keep in mind is when you want to remember something, you think about you're opening up that file drawer and you're putting it in and you're making a conscious decision to remember it. So you're saying it out loud. That's a technique for remembering it. When one of my kids was little, he used to talk about typing information into his computer and he would literally tap on his forehead like that. And so this is the same sort of thing. You are consciously making a decision. You're going to remember it. You're recognizing that the information is there, and it may take you a moment or two longer to find it than it did previously. Part of doing this also is helping reground yourself, right? So all of this is really about not getting worked up into this super aroused state because you cannot remember something. We want you to bring that arousal rate down. So one of these techniques is to ground yourself or reground yourself. And it's a simple technique. You're observing three things that you can see. So I'm sitting at my desk. I see my phone, my computer, and my drink. Three things I can hear. I can hear my coworkers. I can hear the air conditioner. I can hear my chair. Three things you can move or touch. I can move my phone, I can move my pen, I can move my drink. But what you do when you do these things, these take your emotions out, away from the anxiety and toward the present moment. It takes you outside of that whirlwind in your brain and it makes you focus outside and it helps decrease that arousal level. You can also do another one where it literally is going through your five senses. So, five things you can see, four things you can feel, three things you can hear, two things you can smell, hopefully nothing awful, and maybe one thing that you can taste. So, if you do find this technique something you want to do, then you might want to keep something around to taste. Now, this technique, self-instructional training or SIT, is something that I discovered I was doing all along before I knew what I was doing. What this is talking out loud. This is verbalizing the mental steps or the internal dialogue involved in carrying out a task. So this works out well if you are at work and you are trying to remember a certain set of steps, or if you are trying to help keep yourself focused while you're cooking or something like that. You are literally talking through the steps like a play-by-play announcer. It improves your attention, it focuses your awareness on the task at hand. And the reason why this works is because our brains have a set of executive functions that help us. And so this helps gives that inner voice some dialogue. It makes you aware of what's going on, and it also cuts down on any negative or unhelpful thinking. So this self-talk helps keep us focused. Here are some word finding tricks. This is something that most people have. And I will say for women, menopausal women, word retrieval is a big thing. It tends to have something to do with hormone changes. So anybody who's had treatment for a gynecological cancer is certainly going to be having word finding problems, right? So few tips here. First is to delay. If you can't think of a word, give it a second or two. Sometimes the word pops out. I like to imagine when I'm searching for a word that it's going around on a carousel and it's going to come back. And usually, because I'm doing that, it does pop out. Sometimes you need to describe it. You need to give the listener information about what something does or whatever, or you can give an association, right? So a lot of times, if I can't find the word I'm looking for, I will use other words that not quite right, not quite what I was thinking of, but I'm talking around it. And sometimes I come around enough times, the word will pop out. Synonyms is very, very similar. The key here, a couple of things. Try to relax, because if you relax yourself, that word is going to pop out a lot sooner. And sometimes you just need to come back later. And also, a trick that most of us have gotten used to using is you can always Google it. So I always have troubles remembering a certain word. And so, which of course I can't think of right now, but evidence-based, that's what I never can think of it. So I will type into Google something around it and then it comes back to me. So you can try Google. Google is a wonderful technique for that. Another technique to work on is paying attention. It is really, really hard to pay attention when you have CRCI. So use active listening skills, which is really paying attention to when somebody's talking to you, looking at them, paying attention to their tone, repeating back what they said to you. It's a summary, so it's a clarification. And then they can clarify if you didn't hear or not. The key here is not to start figuring out what your response is going to be while they're talking, but to listen to what they're saying. Other techniques with that is when you meet someone new, say their name to yourself 5 times and use it when you say goodbye. Make sure you take notes in your own words. There is something about actually writing things down that makes a difference. And you want to encode this information by making it as rich as possible and thinking about it in terms of multiple senses. You want to set yourself up for success by decreasing multitasking. Now, many of us think that we are multitaskers, but what you see in research is that we don't. We think we are, but we're really not. And we certainly can't do it post-cancer treatment. So decrease multitasking, make a list of what it is that you want to do, and break it down into smaller steps. You can pick one thing to work on and complete that before you move on and focus on one thing at a time. This will help you tremendously. Make sure you minimize distractions. So get your materials together ahead of time, work in a quiet area, or use white noise. This is something that I struggle with. I'm in an office space with 8 people. It can get noisy in here, especially when there are conversations going on. And so we have these noise canceling headphones. I can still hear what's going on, but a coworker of mine, her trick is she has those on and she plays white noise through them so she really can't hear in other stuff. So there are different ways creatively to help minimize distractions. Make sure you're having conversations in quiet places and then give yourself plenty of time. Take breaks as you need so you stay fresh. If you're working on something and you find yourself being distracted, stand up. It breaks that cycle. It helps you refocus as well. Being organized and consistent are really key here. So make sure you're organizing and keeping your things in specific places. I do this for my husband. Again, he doesn't have CRCI, but he can't seem to keep track of his keys or his glasses or his wallet. So he has a drop spot where that is where he's supposed to put his things. So it makes it easier to find it if that's where it's supposed to go. You want to set up and follow routines, try to keep the same daily schedule. You can use a daily planner. That is much better than a to-do list. Um, Mark important appointments on a calendar and use sticky notes judiciously. The problem when you use sticky notes all the time is you stop seeing them. So we like to suggest to people that they use a paper calendar, that they write things in pencil so that it can be moved. Some people find that they need or prefer to use their electronic calendar. The beauty about having our phones and our calendars that way is that you can set up alerts that will help you remember things too. Another key to managing cancer brain fog is working on coping and acceptance and adjustment. Now, I use the word adjustment instead of acceptance because honestly, it's easier to adjust to something than to accept it. So you need to adjust to your memory problems. Everybody's cancer experience and side effects are unique. And so you really do need to look at your expectations. What are your expectations for how you should be doing? And what are others' expectations? And don't focus on how much your symptoms how much the symptoms bother you because that creates more stress. So same thing with others' expectations and your expectations. They may not align, and it doesn't matter what they are. You've got what you've got. You need to be present in the moment instead of looking it back or even looking forward. Let's work on what's going on right now. You want to work on relaxing instead of tensing when you can't remember something. For a long, long time, when my CRCI was bad, I would get to the end of my street and I couldn't think, did I turn left or right to go to the grocery store? And I would get so worked up and so stressed about it that I couldn't do it. I would almost start crying. Now, the reality is I could go either way. It doesn't matter. They are equidistant for me. But I would get so worked up. So when I started to just laugh at myself and go, oh my gosh, Linda, not again, of course, just go and then you'll find the grocery store. I was able to relax instead of tensing up about it. I don't even think about it now when I get to the end of my street. You want to work towards adjustment to your memory challenges versus acceptance. And at the same time, have a few thoughts in your back pocket for when somebody gives you an unhelpful comment, such as, well, so and so had your cancer and this is what they're doing. And you can just thank them. Wow, that's interesting. Thank you for sharing. Or, hey, that's great for that person. So you need to figure out how you want to respond to those things and keep in mind that you're probably more aware of your issues than others are. You want to normalize your memory challenges. This helps de escalate things, right? So when you recognize that everybody has memory challenges, maybe not as dramatically as we do, but everybody has these issues. Go back to the slide I showed you with like, did you lose your phone, your keys, etc. Everybody has these. This allows you to recognize everyone misplaces their keys. It allows you to have more adaptive thoughts than maladaptive. And it also changes this helpless, distressed related thinking to more adaptive problem solving things. So this de-escalates that stress response. It allows you to smile and even use humor. And this is probably the most critical thing to learn is to help yourself by smiling and recognizing, yeah, it is what it is. Yeah, we want to short circuit that stress cycle response. Another technique here is to manage your mind. How do you do this? Not always the easiest thing, but we want to work towards keeping things in perspective. So you want to challenge self-talk. Most of us don't have very nice conversations in our head. A lot of times it is very negative. I have very negative self-talk that it's automatic. This is something that's been with me for many, many years. I don't have to listen to it and I can challenge it because mine usually starts out something like this. Linda, you're such an idiot. Well, maybe sometimes I am, but most of the time I'm not. So I just recognize that it's like a buzzing of a bee, um, outside the window. It's just there. I don't have to pay attention to it. So challenging self-talk is important. Another thing that's really, really helpful is humor because that builds resilience to stress. It improves overall physical and emotional health. It helps us to look at things in a different way. It helps us relax. It helps normalize behavior and experiences. It helps keep relationships strong. It helps us retain and share information. All of these things really, really critical. Humor just helps. Another technique to do or use here is to decatastrophize. It is very, very easy to jump from one thing to huge catastrophe within seconds. It's super, super easy. But this technique, this if then, what would I do? Or then what? This thing helps a lot. So when you have a catastrophic thought, approach it, think about it, ask yourself, what would I do if what such and such would happen? And you answer it. And then what I would do, you answer that question. And then what? You answer that. And then what? And you answer that. Because what this does is it emphasizes the steps to remedy the consequences of the issue. You are actually finishing the thought because when you are trying to avoid a thought that feels pretty catastrophic, it's going to come back around because that's what it does, because you have never answered the question. And when you go through this step of the what then or then what, you are problem solving and you're taking a great big problem and you're making it smaller and smaller and you're giving yourself an answer and it de-escalates the crisis. This is a technique that we use in our class and our participants really, really love this one. So we also want you to counter negative thinking. So pay attention to what you're telling yourself during anxious moments and answer that critic. So you're challenging the thought, you're reframing it, and you're using some mindfulness and relaxation techniques. So this is, I go back to what I say to myself, Linda, you're such an idiot. And then I challenge that. Are you really an idiot, or is this based off of an automatic thought? And so you can reframe these things. If it is actually something else, you can replace that negative thought with something more balanced or positive. So, for example, the thought could be, I just can't do this anymore. It could be changed to, okay, I'll try again tomorrow. And then, of course, going back to using breath work and grounding exercises, quick relaxation, those things will also help you. Another technique, and I use this one frequently, is judge and jury. So this is when things come up. I explore what the evidence is for and against whatever it is that my brain is telling me, such as um, my cancer is back and I'm going to die. Well, what's the evidence for that? And what's the evidence against that? So the evidence for these things are only things that can be substantiated and verified or corroborated, not what your negative voice is telling you, but what the evidence is there. So you're asking what's the evidence for certain things, what's the evidence against, and what's the alternative view. What else can you tell yourself and how else could the situation be interpreted? So this is a really great technique. I use this almost without thinking about it when things come up because it just helps me calm down that voice in my head that sometimes can get out of control. Another technique, and this can be used for a variety of things, but it's great for worry, is to schedule worry time. So if you have something that you really are worried about, then you set time aside specifically for this. It could be 5, 10, 15, 20 minutes a day. You set a timer, you really wallow in that worry, and you use that time to do some problem solving. And why this is great is because this isn't telling you not to worry, but it is giving you place and it's honoring the worry and it helps you do some problem solving during that time. So this is asking yourself, is this noise or is it really something that's going on? What am I worried that's going to happen? Is this a real problem or is it an imaginary what if? The what if is noise. But if there's something that is a real problem, then you can use this set aside time to do problem solving. And then if the worry comes up later in the day, you simply tell yourself, I've had my worry time for today. You have to go on to tomorrow's list. It's a great technique. It's also a great technique for people who find that they can't stop crying. So this is time to cry. It's time, whatever. It's a great way for providing some structure around some discomforting or uncomfortable thoughts. Gratitude work is also something that's important. And I sometimes call it gratitude work, sometimes I call it thankfulness, whatever. What's important about this is that when you look for good things or things that went well, it sparks brain activity that's critical to sleep and mood regulation. The act of looking for these things is as important as actually finding them. They have to be real. They can't, they need to be highlights. So you literally do this once a day at the end of the day. You look back, you sit down, close your eyes, and think about things that happened. What are three good things that happened? And those are your highlights. And it could be as simple as today, I didn't hit a single red light on the way to work, or the pumpkin lattes are back, or I got great news, my scan was clean. It could be big, it could be small, but it has to be real. And you write these things down and you reflect on them for about 15 to 20 minutes, 20 seconds, sorry, not 15 to 20 minutes, that's too long. 15 to 20 seconds and think about how it was different and why you want to remember it. And this could be gratitude, it could be thankfulness, it could just be remembering the moment, right? All of those things are really the same. Call it what you want, but try practicing that and see what happens. Another technique, another here is working on communication. This is really something that all of us can do that we could all be better at. So don't be afraid to talk about your cancer brain fog. Tell your doctor, tell your healthcare team, tell your family. Your doctor may be able to help by changing your treatment plan, or they may be able to help manage the side effects. It could be something along the lines of improving your sleep, managing pain, any of those things. It could be something, maybe they will decrease the chemo and maybe it goes over 6 weeks instead of 4 weeks or something like that. It's really important to talk to your healthcare team about that. And you can also ask if they would refer you for speech therapy or a neuropsychologist. Keep in mind that your loved ones may also be struggling. You may have had the cancer and gone through treatment, but they are also impacted. It is often more difficult to be the loved one than it is to be the patient. All the attention and energy is on the patient. And the loved one is standing there trying to recognize when they should intervene, when they should hold back, whatever. It can be really a challenge. And they may not feel like they can complain to you, but they may also be feeling frustration and stress with your challenges, especially around attention to memory. I have heard from many patients how their family will go, Mom, you already asked me this 15 times and I've answered it, right? So remember, you're on the same team and you're facing this challenge together. One of the ways to do this is by providing structure to others. So you're setting clear guidelines. That's going to help prevent or resolve tension. You're setting limits with your time. You're letting others know if you don't have the energy or brain power for something, what you can manage and when you can manage it. So it could be something as I have the energy for one or maybe two of these things today. What's most urgent and most important for you? Remember that no is a complete sentence. Sometimes you just have to say no. The problem is when you say no to something and you give an excuse for it or a reason for it, that opens the door. So it could be as simple as, no, thank you so much for thinking about me, but I'm not able to do that now. You don't have to give a reason why, but you just stick with the no. You're a broken record about that. And then for close family and friends, consider a phrase or a sign that you need more time to think through word choices because you're too tired or stressed or fatigued to address something now. In my family, I would say, I'm having a chemo brain moment, and I would do the timeout thing. And they would literally throw their hands up, back up like I was a bomb that was going to explode. But they knew that they needed to give me space. And I just recently had to deal with this with my sister who was in town, who feels like when I can't think of a word, that yelling at me is going to help. And so I literally said to her, "This is not helping. Back off." And so then we had a conversation once the words came back to me and I was able to explain to her what I needed her to do. So, these conversations are really, really important. I feel it's important to talk about CRCI with other people. I think people don't understand what it is, they don't understand how prevalent it is. But at the same time, you get to choose what you want to say and what you want to share. You are not obligated to explain yourself. But by having some responses, by providing structure, by having clear expectations, this also helps. It also helps to have some quick responses ready to address issues like that. The thought escaped me, or it's been a long day. Even being really um, even being very direct and saying, you know what, since going through treatment, my brain works a little differently. I'm going to take notes during this conversation so I don't forget anything, or I'm going to ask to repeat back to you what you said. I mean, it's important to share so people understand. And not only that, so you're educating people for future patients who are following behind you. Sometimes going back to work, this is an issue. You want to start out slowly. You want to create a to-do list. You want to use sticky notes, but not too many to remind yourself. Make sure you're referencing your calendar throughout the day. Ask about accommodations that might help you succeed better, such as recording meetings or organizing your work area for better concentration. There are some excellent resources at Cancer and Careers and at Triage Cancer. Both of those are wonderful sites and have lots of information about going back to work and challenges that you may face. Maybe work isn't for you anymore. You may find after treatment that you don't want to do the same thing or that you're not able to do that. So it's okay to acknowledge and grieve those losses and talk about those with others. Working on energy is a critical piece here because fatigue plays a huge part in CRCI. So you need to acknowledge that you have a certain amount of physical and emotional energy and you want to use it appropriately. So you don't want to push yourself beyond the energy that you have because that is going to make your memory and attention issues worse. So do this by pacing yourself, knowing what your priorities are, what you want to do, and how long it's going to take. Be hyper realistic. Don't waste your time making a list that says it's going to take you 30 minutes when you know, in fact, it's going to take 2 hours. So if you don't make realistic plans, you're not going to be able to do things without overdoing it. So if you have issues or difficulties with this, consider keeping a log of how long you think something's going to take and what actual time it took. The spoon theory is a wonderful metaphor for pacing. If you think about the number of spoons you have is what the available energy you have for each day. Most people have somewhere around 12 spoons. Every every activity you do takes one or more spoons. If you start using up too many spoons, you have to ration your spoons. Using too many of those can lead to exhaustion, and you cannot borrow from the next day without having to pay for that. So, spoon theory is a wonderful metaphor. There's lots of information on the internet about that. If you would like more information about that, my contact information is at the end of this, and please feel free to reach out to me and I will give you more on that. One of the things I like about spoon theory is that it becomes a great descriptor, and you can use this at work and you can use this with friends and family, and they understand. You can say simply, I don't have enough spoons for that, and they'll get it. There are things that are energy takers and energy givers, focusing on the past, stress, anxiety that takes away energy. Things like nature and resting and sunlight and gratitude are energy givers. It's important to prioritize good sleep. because memories are made permanent during sleep, and you need 6 hours of natural sleep, no sleep aids, to make your memories stable. You need to keep a regular schedule. You need to establish rituals that help you relax at night. All of these things are going to help with sleep. If you're having issues with sleep, make sure you talk to your doctor about that and maybe get a referral to sleep specialists. Addressing fatigue and sleep is important because this is going to help minimize your CRCI symptoms. So you're identifying priorities, what you want to do, what you need to do, and how long it's going to take, and you're embracing the spoon theory. So in closing, here are major keys. You know your problem areas and at-risk situations, so you have a plan. Manage your stress reaction and learn to laugh at your CRCI. You're going to pause, breathe, recenter, reground, and carry on. And you're going to relearn to trust your brain. The information's still there, it's just in a different file location. There is a lot of hope for the future. Everybody's experience with cancer brain fog is different. Most people will see their problems go away within 6 to 9 months. Some people will have it longer. But remember, only a third of people who have been treated for cancer are going to have long-term cognitive changes. There is help available. Ask your healthcare team. There are a growing number of programs throughout the US to help with CRCI, including ours at Sharp Healthcare. We have an 8-week class. It is free. It is available to anybody in the United States. If you want more information about that, you can also reach out to me. Now, keep in mind that recovery from cancer can take years. The side effects don't end just because your treatment is ended. So, finding strategies that make things easier, humor, all of these things, support groups, great ways to connect and learn new coping strategies. So, here is my information. You can always reach me. My phone number, my email address are there. Thank you.